Hello and welcome to News Up Now. I'm Gleidson Martins. On the agenda today, we'll be talking about recovery medicine. And to talk about that, I have here in the studio Dr. Keith Loring from the Health Right 360 in San Francisco. Thank you so much for coming in.
Thank you. It's a pleasure to be here. Thank you for inviting me.
It's such a difficult topic to talk about because there's so many parts unknown, at least for me. And I think for a lot of people too. But I want to start off, like, how did you get involved with the Health Right 360?
I'm actually there because of one of the practitioners in the recovery medicine clinic, Dr. Jacinto, who has kind of built up the addiction or recovery medicine program within Health Right 360. I've spent almost 25 years in emergency medicine, and finally had enough and took some time off, and my own sort of struggle with substance use and all that all kind of informed me that, gee, maybe I should get into this kind of practice.
When you say struggle with substance?
Well, I had my own issues with addiction.
Okay.
Back many years ago, and so and when I went through that, I didn't have in mind that I'd actually also then turn around and be helping people with addiction. I worked through it, moved on, but everything kind of came together. I had burned out, was done with medicine, I thought, completely, and then one thing led to the next. Within all of my spiritual work and everything else I've been doing, this is where I want to spend the rest of my career.
Okay.
So I found out about Dr. Jacinto. I spoke with him and realized that he really saw things the way I did, and that is that we have to take a look at the patient from a multidisciplinary perspective, and we have to be willing to look at what really drives addiction. And it's not that a brain, that somebody starts taking something and becomes addicted. Mm-hmm. It's because of the trauma that they carry, the wounds that they carry.
So we're going to go through that, because I have one question about talking about brain, since you touched that topic. But before we go there, or before I introduce someone to San Francisco streets, to talk to some people about addiction and how there's one character for the story. He was mentioning like what he's seen on the streets, and he talks about his experience. Let's watch it. I'm going to ask Tammy to play.
According to the San Francisco Department of Health, there is an estimated 22,000 IV drug users in the city, and there were 200 overdose deaths this past year. Just a stone's throw away from the 9th Appellate Court and the Twitter headquarters, we saw people selling and buying drugs, people laying around in various states of consciousness, or they were just openly shooting up. A security guard who works in the Civic Center area spoke to us off camera.
Prescription drug, and they can't use that. So they have to get something to supplement that. And when they try to supplement it, it usually gets them onto the other stuff. And then you add that with mental illness, and you got the problems we got.
And he shared a vivid example he's seen of extreme addiction.
She was a homeless girl with a grocery cart, and it had umbrellas on it. And the umbrellas were covering her. And she had stopped in the middle of the street, and we wondered what was going on. Why did she stop? And once we said that she stopped, I'm like, excuse me, ma'am, but you have to move on. You can't just sit here with a cart full of stuff. And as soon as she moved her head, she had a needle in her neck, she had a needle in her eye, and she had a needle in her cheek. It was the scariest thing.
We came across two police officers who have worked at Six and Jesse for several years. They did not want to speak on air, but they told us that there's a lot of drug activity, drug addiction, and open drug use in the city. They feel outnumbered in their ability to help everyone because the problem is more than addiction and mental health, but a culmination of many factors combined.
San Francisco has more help for homeless and drugs and everything than a lot of places.
And the two police officers said that at the end of the day, the addicts would rather be out on the street because it's easier for them to get drugs there, and it's what they're used to. Gleidson, back to you.
Okay, that was Tammy Lee reporting. So she's mentioned one of the security person. He's mentioned about supplement drug. Mm-hmm. So what does that mean?
So the history is this, and there's maybe you've seen a lot of this in the news. the pharmaceutical industry developed a number of opioid medications for pain relief, which were all well intended to, relieve the pain of severe trauma and all these other things. Well, and they, despite sort of knowing in the development of this, as they developed stronger and stronger opioids, it was known in the research around it that they had addictive potential, but that was suppressed, and so physicians began to continue to we continued to prescribe these and realized patients were becoming addicted, and then there was a lot of pressure to we've got to wean people off of these medications. And so the result of that is when people were no longer able to get prescribed opioids, they turned to heroin.
They're going to go to streets.
They're going to go to the streets, yep.
That's what they're saying. Like, it's easier to be on the street because they get what they need and what they want.
Right.
So, which is very sad because, the story the security guard was telling us, this woman on pushing her grocery cart and with umbrellas covering her up, and then you see a bunch of needles on her face. Is that our reality?
It is our reality. I mean, that's sort of an extreme example, but it is our reality. Anybody who takes the time to walk the streets through, especially the Tenderloin and areas downtown, you will see people shooting up intravenous drugs.
So you mentioning about once somebody doesn't have more prescription to get the medication that person was on, and then they're going to go to other sources, right? So is that in a part of the brain that needs some of like that kind of powerful medicine or drug?
Yeah, so that gets into the whole reward pathway of the brain and how that works. Opioids specifically work on the endorphin receptors in the brain, and when those receptors become used to external opioids, they upregulate. You need more of the drug in order to get the same effect, and eventually you get to a place where there's dependence. And if you stop using the drug, the body goes into withdrawal. And so the pain of withdrawal is just too much. And so at that point, people then will cross over into the line of addiction. And I want to be really clear about what addiction is versus dependence, because that's a really important distinction. So, any of us, probably everyone has experienced dependence on something. Maybe like they get used to drinking coffee every day, and if you don't drink your coffee every day, you get a headache.
Yeah.
That's dependence. The body says, "Oh, I need this caffeine." That's dependence. But then it's easy for someone to say, I really don't like the effects of this caffeine. I'm going to cut down, and you do it. So the difference, addiction is when, despite negative consequences, so there's craving for something, it brings pleasure, short-term pleasure and or relief, but in the long term, it causes negative consequences, and despite those negative consequences, people continue to use. At that point, they can no longer control, they no longer control their use, and they will use despite, living on the streets. They'll do whatever they have to because the brain is crossed over into this place where this substance becomes more important than other parts of survival, becomes more important than food, than sex, than survival.
And that's where it comes, the health Right 360 clinics in San Francisco.
So to really work with addiction effectively, it's important to understand not just the biology, which I just sort of touched on, but it's important to understand what really drives it. And so we don't become addicted to something because we use it more and more and more and more. We become addicted to something because there's an underlying wound or trauma that an emotional, something that happened during childhood. There's always a story underneath, whether it's known to the person or not. So when if you stop and think about it, all these substances, if you talk to a person and ask them, what does heroin do for you? And what does it do for you? Well, an example, a patient said, the first time I used heroin, it felt like God came down and put a blanket around me for the first time. So what's wrong with that? Don't we all want to feel that way?
Absolutely.
So, so that tells me that this person didn't have safety when they were young. And so to treat addiction, we really have to really be willing to not only look at our own issues, but recognize that underneath addiction is trauma, and it's either the things that we didn't get when we were raised and nurtured that we should have gotten, which is maybe a mother that's in postpartum depression and an infant doesn't get the nurturing that they need. Or the more obvious things, the big T traumas, sexual abuse, physical abuse.
And how to find out, like, let's say I am, as an example, I have an addiction, whatever it is, right? So how can I find out which trauma I had? So is that through a therapy, psychiatrist, or what is the best way?
Great point. Everybody is going to access that differently depending on what it is. But the most important thing is that they go to a place that's informed and is willing to look at that person both as an individual, and say, gosh, and have availability of individual therapy, psychiatry if necessary, which focuses more on medications for mental illness. And of course what we do is we provide medications to help take over the, for instance, with heroin, we offer a medication called buprenorphine, and with this, it's a medically assisted treatment that takes over the work of the heroin, but doesn't give a high, and actually allows people to get back to a place of stability and start working on the stuff underneath.
And you offer the counseling too?
We offer counseling. I do some counseling as a way to help people access the story underneath, or at least to help them connect with it, and then to offer advice as to, it looks like you could really, you would benefit from going into a residential treatment program. I think maybe individual therapy, or things like acupuncture, other stuff, yoga.
So each case will be a different counseling, different treatment.
More or less, yeah.
Yeah. So anybody can go to the clinic and it will be treated?
So Health Right 360 is a federally qualified health center. So we serve the safety net. So that means so if you have private insurance, then you'll need to go wherever your private insurance will let you go for addiction care. But we take care of, what we take care of is essentially anybody who walks in off the street and has nothing. We get them qualified for Medi-Cal or whatever. And so we take Medi-Cal and uninsured and Medicare.
So another topic is the safe injection site in San Francisco, which your clinic is behind it, right?
We were lobbying with the city to be a part of setting up safe injection site, and eventually this will happen. It has to. It's the right thing to do, and that'll be down at the Tenderloin Health Services site. I've heard there's going to be the formation of a committee to look at meth. Because meth, I think, actually is a bigger problem than heroin. 25 years in the emergency room, we saw far more problems related to meth than heroin. It's just that because of the opioid crisis and people reaching to heroin and then fentanyl, we're seeing people dying.
Okay. So what is the best way to contact you or Health Right 360?
So I don't have the phone number with me, but
May I say?
Yeah, sure.
Okay, I got it. So it's 800-200-7181, 800-200-7181. So it's on the screen right here for you. You can call and ask all the questions and find out what is the best treatment for you. Dr. Kit, thank you so much for being here.
Sure, and I will add to that one more thing, and that is that you can literally stop in any day of the week, any Monday through Friday, to our intake department. Come in at 8:30 in the morning. They do a general intake, and they meet people where they're at, so you can just show up.
All right. Anything else you'd like to add?
No,
Yeah.
it's been my pleasure to be here, and
Well,
thank you for
so
inviting
much.
me.
Very nice meeting you. Thank you so
Yeah.
much. And thank you so much for watching. Next Saturday will be more News Up Now here. If you have any questions, please let us know through our email address, noon, N-U-N, @newsupnow.com. Thank you so much for watching. I'll see you next time. Bye-bye.